Morning. Let's return to this developing story now with regards to the British Medical Association reporting that members have overwhelmingly backed collective action. Let's cross to the newsroom. Ashish Joshi, our health correspondent, is standing by for us. Ashish, what more do we know and what will the impact be?
Well, the impact will be that GPs will now restrict the number of patients that they are contracted to see legally. Remember, there's a contract between GPs and the government, and this is about the number of patients on their register. What this industrial action means is it's not a strike. That means they can't stop seeing patients altogether, but they can limit the number of patients they see. Some patients might say, well, how will we know? Because we can't get a GP appointment anyway. But the real danger of all of this is that the patients who are not being seen by their GPs will then go to accident and emergency and put more pressure on the hospital system. So that's the danger of all of this. The NHS England, and these are GPs in England only, I should stress. NHS England are saying to patients right now, do go and see your GP if you feel you need to. The doors won't be closed, you won't be turned away, but they will certainly see an impact on the number of patients being seen by GPs. And it's a lot to do with the backroom admin data collection that goes on in a GP surgery that we don't see on a day-to-day basis, but that's all the work that's gathered, the patient information, and passed on through the primary care network into the wider health service. That will all stop. So it's removing all that data work, the admin work, and limiting the number of patients they say that they see in a practice. This is because of a contract which was renegotiated by the government, put to GPs in April. That was rejected, a ballot was taken, and this is the result of that ballot. So going forward, there will be industrial action at GP surgeries across England.
How, Ashish, do you expect briefly Wes Streeting, the Health Secretary, to respond to this?
We haven't had a reaction from the Department of Health and Social Care, but given the strides he's made with the junior doctors, I'm sure he'll be very keen to sit around the negotiating table and stop this industrial action before it's real impact on hospitals and, of course, that record waiting list.